Hi, and welcome to Medical Malfunction. I am stopping to take a moment to answer a quick question about AI searches and health conditions. And there's a reason I'm doing that. Apparently, the numbers are out and AI is popular. And that's, of course, to be expected. But here's the bigger surprise humans are making decisions based on AI answers without looking further. And the numbers are pretty high. One statistic I heard today was 38%, kind of high. So if you're making a decision about whether it's a health condition, health treatment, anything related to doesn't even matter. If you're making those kinds of decisions without really looking further into it, or even what's the source of this answer, let's just take a moment and see what is the source of the searches. And so let's take 5. So what I'm going to show you really quickly is, and by the way, that's a 2025 statistic, that 38%. So that's pretty new. But the first thing I want to say is I think a lot of people, meaning humans, literally, think that, pardon me, no, I have some medical updates myself, and nausea is one of them for me today. Um, but one of the reasons for it is that we believe that AI is unbiased in its gathering of content for us, and so we might make a decision very quickly. However, while that may or may not be true, the fact is it does tend to look for good quality, which is very reassuring. But how does a computer or artificial intelligence, which is what we're talking about here, know what's good quality? So I'm going to give you an example of something. Here's something I've had to deal with this week, and I thought this is a great example. And there are 2 things we're going to look at. One is that AI overview that you get when you do like a Google search, because guess what? Google searches haven't gone anywhere. No, they are not dead. They are still with us, alive and kicking, in the sense that people just do the Google searches and then look at the AI overview and then go off and running based on what they see there. But if you take a moment, you can see also what the sources are. So I want to look at one example that's not so great. So let's do it real quickly. One of the things I've had to deal with this week is something called a seroma. Fairly simple thing, right? Seroma is just a fluid gathering. And I happen to have, I call it a souse. It's a seroma of unusual size. And because, I've been in breast cancer treatment and I'm happy that I still have those, but I also have a seroma. So here's your AI overview. I just went into Google. All I typed in was seroma, nothing else. Didn't ask it anything. So I didn't ask any pointed questions like about treatment or anything like that. Just type the word, and that's all that I did. Now, that's a very common thing to do, and I know that because on the daily, I review things like SEO searches and what people actually look for, medically speaking. So, it seems pretty basic, not really much there, but, pretty basic, fairly accurate. But look at basically your first source there, Wikipedia. Not to shade Wikipedia, but it's not exactly where I'd want to go for medical information or whose doctor I'd be booking, right? Things to know. Now, there's Healthline. Healthline, we're getting closer. There's WebMD, also a little bit closer. Now we're getting a little bit better. So in this particular case, and then I get some random one. NHS is usually England. So then you get the American Board of Cosmetic Surgery. So, and then you get to cancercenter.com. Interesting. So not even the American Cancer Center or a nonprofit, you're at a .com. So without typing much into the search, just typing a word, this is what you get. But I wanted to show you that, so now these are your primary sources. So whatever you're typing in, take a moment, check things like you can see the date here is January 5th, 2025. Well, that's pretty reasonable as far as recent. This other one, though, the one that actually shows up at the top, is from October 2022. Maybe not that much, difference as far as that goes. Could be a world of difference. In healthcare, a couple of years can be a couple of decades in human time. So then we've got a couple of lovely illustrations in Wikipedia land. A better way to have done it, would have been to use something like obviously using search terms is a very specific discipline, but this also includes the ChatGPT or any type of tool like that. So I'm just showing you the AI overview. And let me do this before we move away, because these little links right here, they show you what the sources are. And if I had done a better search like this, how do you treat a seroma, let's say surgically? Now you're going to get a whole different bunch of information. It's going to be a little bit better. Some of the more authoritative things are going to bump a little bit further to the top, but not too far. WebMD disappears completely. But that's what I wanted to show you, is these are how you check your sources. Check your sources, it's still a lot of cosmetic ones, as you notice. But see, look, and then that one is all the way back to 2007. Again, that's not to say that things have changed that much in the world of seroma or serome. I don't know. But that's the World Journal of Surgical Oncology. So just want to show you that your main sources may not be that recent. So you need to see how I clicked on that little paperclip there. Paperclips are going to show you the links, your sources for that information right there. So that's what you need to be paying attention to, especially if you're running off and making decisions. And so you can see that all I did was put a little bit, and then of course it'll give you, let's see, there's one for hernia, abdominal, blah, blah, blah. You can adjust your terms. And there are other ways to do it. Google searches, again, they do use things like Boolean terms, and you can use a comma. You can use different things like that. Just make your search a little bit better, and your results are going to be better. But just know that it's important that you check the source of the information and the update and the, we think that it's very unbiased, and looking at this is fairly unbiased, but none of this is giving you like a prestige answer like you would get. Let me see. Oh, wait, did we finally see like a Mayo Clinic down here perhaps? No? NHS Foundation. No, we're still not seeing. Let's see. You might want to say something like, how does Mayo Clinic treat seroma at home? That's weird. Let's see how it says. Then you're going to get something that's a little bit more like a current. See, January 2025. They tend to update their information a lot. And you're going to get things that are a little bit more like, you can find some different articles, some different questions. Mayo Clinic also addresses cosmetic, which is fine. So you'll see a little bit more there. And there's your WebMD, which is still, it's so funny because, having come up in the time of WebMD, our cyberchondriac nature, for things, there was a time when WebMD was not considered super reliable, but over time it is certainly built up a fairly decent reputation, I guess, but you don't hear people talk about it like you used to. Personally, I'm going to go look towards something more like a Mayo Clinic, a Cleveland Clinic, a Kids Health, or something like that that's more reputable, and I know has been written by doctors more pointedly, especially for things like this. even though the AI should be pulling the best quality of information. Isn't that what it said? But you don't really know it, but you can look. Now, let's go over into a ChatGPT tool. What is a seroma? Just type it like that. You're going to get a lot bigger breakdown, a lot more answers. But again, unless you ask it, let's see. It's asking, would you like to see a visual? No. What is the source of these answers? You have to ask it. Now it's going to tell you. So it's telling you this is where, so now you can say, okay, I feel pretty good about these answers, that they're probably pretty accurate. And it's basically justifying itself. But you can ask your ChatGPT or your Claude or your Grok or your whichever one you use. These medical references, and it is this is a fairly basic one, but a little bit off the beaten path, which is why I chose it. Plus, I just happen to have had reason to look it up recently. So then it'll ask you, would you like me to get the latest directly from the web for accuracy? And you could say yes, no. You can share, you can look again, you can do all kinds of things. But that's the main thing I want to point out. This is using a ChatGPT tool. Oh, wait. I don't know if you can see that one. Here's the ChatGPT tool. I think I forgot to click the button and you were still looking at my Google AI. But now I think I have to do it all again. I typed in what is a seroma. It gave me this answer. And then I said, what is the source of these answers? Mayo Clinic, Cleveland Clinic, Medline Plus. So basically you can recreate that yourself. But that's the thing that you need to be able to do. Yes, you can sort of trust a robot a little bit. I will tell you that there is a big difference in who is trusting these robots. And that's gotten kind of interesting. What we're finding is who makes most of the healthcare decisions in the house. It's usually women. And in this particular case, women are, I wouldn't say they're the least of the users, but they use these tools less than men do. Men are a little bit more trusting of the AI and the chat GPTs and this and that, even though everybody's kind of using them. Oh, lipstick on my teeth. Look at me. A whole medical malfunction, which is good probably because we're going to start finally talking about that dental stuff because I got a really good question about dental HMOs, but that's a different thing. But I just wanted to show you that so you could see and verify for yourself before you run off and make a decision. That 38% really did stick with me. I was like, oh my gosh, people really need to see where this information, or be able to check where the information comes from. Yes, be able to check the sources that it's giving you, because then before you rely completely on AI, you can say this information really came from Mayo Clinic, or it came from, whichever hospital system might be close to you, or a physician, or at least something that's a little bit more reliable than Wikipedia, because that was a little bit daunting to see on that very first one. And nothing wrong with Wikipedia, but when you're making healthcare decisions, maybe let's bump up the authoritativeness a little bit, or at least dive into the Wikipedia and source that information. So how about that? So I just wanted to take a moment and show you a little bit about how to check your sources on an AI healthcare search, because it has taken over quite a good bit from last year to this year. So there you are. How to check your sources, fine to use it. There's either whether you use the tool or whether you use the Google search with the AI overview. Those are two different directions with a way for you to check the sources, the currency, the legitimacy of how this information is being gathered and presented to you. Okay. So I just let's not go back and start, eradicating polio or something like that. Remember when WebMD came out, everything was cancer, everything. Now it's like, who knows what we might pop up with here, the more information it gathers. We're going to be getting some forward-thinking diseases that it's made up, or some backwards ones, that don't exist anymore. Who knows? But either which way, now how to double check for what is correct and what is legitimate and what is best for you. So now it's time to go out there and get some good medicine and give some good medicine. So see you next time.